Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill, and I'm thrilled to be joined by two of Northwind Pharmaceuticals employees, Katherine Lurk and Steve Zetzl, and we will be discussing how they are changing the way they are serving their clients in the pharmaceutical benefits industry. So, Katherine, if you want to jump us off, thanks so much for joining us today.
Thanks, Lee, for having us. We are thrilled to be part of the conversation. I'm Katherine Lurk. I am a pharmacist by background. I'm the Vice President of Clinical Strategy for Northwind and excited to share more about what we're doing in the pharmacy space today at Northwind. And I have with me Steve Zetzl, who I'd love for him to introduce as well.
Thanks, Katherine, and thank you, Lee. As Katherine said, we are thrilled to be here. I'm Steve Zetzl. I'm the Vice President of Client Strategies at Northwind, which means I get to interact both with our clients and our internal teams to make sure that the products and services we offer actually produce health outcomes.
Great. And you are changing kind of the name of how you call yourselves. Your competitors call themselves PBMs, and you are changing that acronym to PSA. Can you explain really what that means and how you're changing the game there?
Absolutely. We have changed that moniker from PBM, which focuses a lot on management and things that you can't do and rules and restrictions and those type of things, to Pharmacy Services Administration with a focus on the services piece. So for us, the process doesn't stop when the medication is delivered. That's when it starts. That's when we start to talk about how are you going to take that medication? What outcome is it going to produce? How do we make things easy for you? If you have questions, how do you interact with us? So everything is focused on that service delivery structure to make sure that we make this process as smooth and easy as possible for both clients, kind of at the employer level, but for members at that patient level.
Let's drill down a little bit on some of the services you're offering to your end users, employers, and members. Can you give some examples of how you're helping your employer groups that you service?
Where it all starts first is data, insight. How do we help people understand what's happening current state? Where are there risks? Where are dollars being spent? Where are people finding gaps in care? Then we move into sort of areas of influence. What programs and services can be deployed to help close those gaps, to help get a different outcome, to help move them along the curve? One of the things we do with that is the PSA product. So it's managing that pharmacy benefit. We have a lot of different tactics that we can use to help reduce the unit cost of medications. We have an entirely different adjudication system that is a cost plus based accounting system. So it gets rid of a lot of the obfuscation of average wholesale price and discounts and how does it all work? And it's very confusing. So all that gets cut out. We have different programs that can help people with specialty medications. We have different programs that can help people with patient assistance programs. All that sort of comes together to create as much value as possible in how we acquire the medications and spread that cost out. And while that's important, and we know that that produces savings for those that we work with, there will be a point at which you can't squeeze the unit costs anymore. There will be a floor. And so for those reasons, we then need to move from being tactical in how we approach costs to being more strategic. And that's where our clinical blueprint programs come into play.
Well, thanks, Steve, for setting that up. And really, clinical blueprints are the part of the business that I lead for Northwind from that clinical strategy perspective, as Steve said. And really what the clinical blueprints aim to do is engage those high cost, high risk individuals on a plan. We really want to wrap them in high touch, white glove care and really help them navigate through the complexities of healthcare. There's a lot of barriers that get in the way. So there are barriers to cost, barriers to complexity, barriers to accessing medications and supplies they need to take care of themselves. And so our clinical blueprint programs really work to remove the barriers for the patient, enabling them to access what they need, get their medications, get their supplies, take better care of themselves. We partner that with engagement with clinical pharmacists and health coaches to help them navigate the clinical side of it as well, making sure we're achieving outcomes, moving them forward toward better health. Ultimately, we exist to help them live the best lives for themselves and their families. We want to promote thriving and flourishing within their own lives and within their own communities. And ultimately, when you do that, when you help people live better and they are healthier, you are going to lower the overall total cost of care for the employer. So it's a win all around for both the member from an experience and from an access standpoint and an outcomes. They're going to feel better. They're going to be more productive. They're going to engage more in their own lives. And it's a win for the employer. And it's really about engaging the 20% of the population that's contributing to 80% of the spend. And that's really where you're going to start to move the dial on cost for an employer.
So part of those clinical blueprints that I didn't hear you touch about is Northwind's kit that's offered to these employees. And I think that's a little bit of your secret sauce. Can you share a little bit more about those?
Sure. So the kit, as you say, Lee, is what we like to call the carrot and the stick for engagement in our programs. And so what we know is that we can have influence in a population if they show up for us. And our way of keeping them accountable and getting them to show up is by offering a very strong incentive for engagement in our programs. And so what the kit is the medications and supplies that are associated with the targeted condition. So, for example, if we're doing a diabetes clinical blueprint program for an employer, the kit associated with that clinical blueprint would include all diabetes medications, brands, generics, insulin products, etc. All of the testing supplies that a patient would need to manage their care. So continuous glucose monitors, glucometers, test strips, lancets, alcohol swabs, sharps containers, literally everything they need. All of that we package into a single box and we ship it to the patient's door. So everything is delivered to their doorstep at their convenience on time. So their engagement in the program and the clinical side with our pharmacists and health coaches are really tied to their ongoing receipt of those kits. And those kits generally are fully subsidized by the employer. So the patient actually receives all of that for $0 out of pocket. So that incentive is what keeps them coming back for more. It's what gets them to engage with us. And honestly, what we find is that once they're wrapped into our model and our service model, our care coordination, everything we're doing to help them, the incentive is still lovely, but they really start to understand who Northwind is, what we do, how much we really care about them. And it's the relationship that is sustained over time with our patients.
I love that. And you mentioned that, the diabetes blueprint is really where you got your feet wet, but can you share some of the other chronic diseases that you help as well?
Sure. So we have the underpinnings of several clinical blueprint programs in existence. Diabetes certainly is the one that got us started and probably our most prevalent one at the moment. But where we're going quickly is down the path of weight management. As we know, we have a high obesity prevalence in our nation. Currently, statistics are around 42%. And I believe what we know is that obesity is a contributor to many of our top healthcare spends. So when you think high level, you're looking at diabetes, cardiovascular disease, cancers, lots of high dollar expenses that we are already paying for and managing on a health plan. And so the weight management program is really about being more proactive and targeting those individuals who do have high risk with obesity. And again, wrapping them in care, giving them access to support, to medications, to health coaching and opportunities to learn how to improve their lifestyle and behaviors to support an improved way of living. So we are certainly going down that pathway. We have several programs in that world. And then we also have a heart healthy program that, again, is more proactive around managing blood pressure and cholesterol for those individuals. If you're wanting to kind of broadly manage cardiovascular risk, cardiometabolic risk, we are also doing blueprints around migraine management, respiratory care. We have a specialty clinical blueprint that's associated with our PSA that manages high cost specialty medications as well.
That's great. And just a caveat, this can be implemented with any other pharmaceutical benefit. This can be a standalone program as well. Is that correct?
Correct. So we have clients that are blueprint only clients, and they're able to pair that with whatever other resources they have available to them. So whether that is a pharmacy benefit manager, whether that is a different type of health coaching program, whether those are other wellness program resources, we work really hard to interface with what's existing and then only bring to bear the pieces and parts of Northwind services that are needed as a supplement.
Great. And I want to go back to you, Steve, again and talk about you've mentioned the flywheel a couple times and how you are using strategy and service to service your clients. Can you walk us through what that flywheel looks like as part of your process?
Sure. So the flywheel consists of three pieces. There's insight, influence, and impact. And as we talked just a little bit about insight, we have the ability to look through clients' pharmacy claims to their medical claims. We compare those together. And what we're looking for are current trends. We're looking for things we see coming down the path. We look for dark clouds on the horizon. We look for opportunities. We look kind of for what we call areas of omission or commission. So areas where we see patients who are not adherent with their medications or gaps in therapy where there should be other things on board. We also look for areas in commission where things are happening that maybe shouldn't be. We've got duplicative therapy. We've got things that are interacting. We've got those types of things. So we were looking on both sides of that equation to try to see what opportunities exist for improvement. We will lay that all out for clients to help them understand the impact, the complexity, what programs could potentially be put into place to help them. We'll try to maximize, as we said, any resources they currently have available to them to make sure we're not duplicating services. We will then deploy those services, and whether that's a PSA, whether that's our home delivery, whether that's specialty care, whether that's the clinical blueprint programs, whatever that may be. And then we measure it through RX Steward, which is our both member app, where they can interact with us in a variety of ways, as well as our client portal. So as we like to joke, employers can go out at 2 p.m. when they're in the office, or they can go out at 2 a.m. when they're in their bunny slippers and get a really good picture of what's happening with their plan. They can see their pharmacy utilization. They can see their costs. They can see recommendations we've made. They can see how many people have enrolled in a blueprint. They can see what improvements have happened. So if they want to understand, okay, I had 100 people or 50 people or 300 people join the blueprint program, what's been their average lowering of hemoglobin A1C? What percentage of them have blood pressure control? What percentage of them have cholesterol control? All those types of metrics are all constantly available to them so that they can take that journey with us as we work with them to create additional levels of health. As we look at that impact monitoring, that then provides the insight to start the process all over again. And so we will continually look for improvement opportunities. We have some clients who we have noticed have a very high spend in oncology medications, and we're actually working with them on creating additional cancer screening opportunities to make sure that we do education to prevent it, or we do additional screening to catch it as early as possible. Again, all with the notion of how do we help people be as healthy as they possibly can be to be at their best for their families.
Steve, thank you so much for sharing that. And I love how y'all are truly taking the investment in the pharmaceutical space of your clients and using their dollars wisely to really get the biggest bang for their buck and take care of their members for their full journey ahead. Can you share some testimonials or some stories of success of some of your current clients?
Oh boy, could we? We could be here for a while, but I think I will use one particular example because it is a great illustration of how everything can come together. We had a client that was a utility that knew that diabetes was an issue for their population, and they had deployed a health coach within their population about 3 years prior to starting services with Northwind. And unfortunately, because there was a little bit of a lack of programming and there wasn't really an incentive to join the program, they had not been all that successful with their efforts. They then started with Northwind for both the PSA product and the diabetes clinical blueprint. And because there is a program, because we were able to create excitement, because we were able to partner with that utility, we had about 100 members sign up for the clinical blueprint by the end of the first month of enrollment. And we were really, really excited about that. And what happened was, because we made access to medications easy, because we reduced the copays, because we provided the additional educational support, because we provided lifestyle coaching, because we did all those different types of things, patients were able to engage and actually restart their medications or get on the proper medications or stay on those medications. Or in some cases, we had people who had avoided care with the medical system altogether and were finally able to come forward and say, yes, it is time. I do have the ability to engage and manage my own care. We knew that the client was going to make a pretty big investment. And so we used the savings from the other pieces and parts of the PSA. So we used increased generic percentage. We used a lowering of the unit cost of the medications. We used all that to help them fund their additional spend in diabetes. And because we had more patients, because they were taking their medications, because they're on right medications, they made about a $900,000 investment in pharmaceuticals, additional to where they had been to care for these members. But what happened was that these people got better because they were engaged. And so hospitalizations fell, ER utilization fell, cost of complications and care of those all fell. And so they ended up with over $2 million of savings on the medical plan. So inside one benefit year, they made a decision to support their employees, to support their journey to health and diabetes, and they received over $1 million back on that investment. And while it's great for us to look at the metrics of hemoglobin A1C, while it's great for us to look at the investment in terms of, yes, blood pressure lowering, those type of things, I think Katherine can help us with the human stories of what happened, because we know at the end of the day, it really is about what's occurring inside the lives of those patients.
Well, thanks, Steve. You shared the bigger picture of the client success, but how did we create that down on the individual level? And so happy to share a few stories about patients that we've interacted with directly and what they've experienced with Northwind. So since we're talking about diabetes, I think the first one I'll share is about an individual who engaged with Northwind. This was through a client that had a diabetes program. This individual came in with an A1C very uncontrolled, but basically had every excuse in the book as to why they weren't taking care of themselves. They couldn't afford their medication. They couldn't track it down. They couldn't this, they couldn't that. And when the program was put into place, this patient actually shared with us that the program gave him no more excuses. So he fully embraced it, engaged with us, basically took his A1C down 6.9 points in a matter of 6 months. This individual also shared with us that their child approached them and said, Dad, what's going to happen to me if something happens to you? And so that was a huge motivator for the patient to say, I got to be here for more than just me. I have a family to take care of, and there's more to it. Down the road, what's also very interesting, and this patient shared later, was that they were struggling with renewal of a license for their ability to work and do their job. So they were on very short renewal cycles because of their health being poor. And because of the program, because of his success in the program, his commitment to his health, his most recent screening, because his A1C was controlled and in a much better place, he was able to get the longest approval for continuation of work so that he can continue to do what he's driven to do in his career. So again, as we said, human flourishing is about living the best life for you, yourself, your family, but it's also about doing your best in your career and for your employer. And it's really pointing to enabling people to do that. Additionally, we have a story of an individual with type 1 diabetes who came into our program basically unable to afford their medications. And for those listening, type 1 diabetes is probably one of the most high risk conditions that individuals deal with, as far as even escalations of care, risk of hypoglycemia, significant health events, et cetera. And so this person came into our program with an A1C of 10.5. And in as little as 3 months, because of access to medication, because copays were no longer an issue, this patient was able to get all of the medications and supplies they needed. And so in 3 months, their A1C dropped to 7.2. They were in a much better place and eternally grateful for the opportunity to participate in our program. And finally, I'll share a story on the weight management side, but basically had an individual come into the program who was on 3 blood pressure medications. Mind you, this patient was in their 30s, but carrying significantly more weight than they should, 3 high blood pressure medications. And on enrollment, their blood pressure was averaging in the 170s systolic, which is significantly elevated and certainly risk for cardiovascular related poor outcomes. So they came into the program. We were able to engage with him. He fully jumped in with both feet. This patient, in a matter of less than 5 months, has lost 80 pounds. We are now having different conversations about their blood pressure. It's averaging in the 120s. They no longer have symptoms of gout. They have completely changed their lifestyle. They're eating healthy. They're cooking all their own meals, and just has experienced a complete life change because of the program, because of the support, because of the coaching, the access, and basically feeling the success of that weight loss and what it's done for his life and how it's made him feel. And he's really motivated now to maintain that because he knows as of not that long ago how differently he felt and was functioning. So just a few stories. And as Steve said, we could sit here the rest of the day and talk about all of the successes that have come out of the program and how it's truly changing lives for the better.
Well, I love that no excuses. There's no reason not to take advantage of this program. And if anybody wants to get in touch with you guys and learn more about how they can benefit their members or the employer groups that they support, where should they go?
They can go to www.nwpharma.com, or they can send us an email at support@nwpharma.com, or they can sign up for the mobile app and they can send us an inquiry through that, which can be found on Android or the App Store under Northwind Pharmaceuticals. I don't think so. Thank you, though, for the opportunity. It is always an amazing chance for us to talk about Northwind and that stewardship model as we try to help employers and members get to a better health state.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.